Hello, everyone. It's Wednesday, August the 11th. Regretfully, but happily also, I am announcing to you that we've only had 2 additional deaths since Monday. Nevertheless, these are great, in every way for these great West Virginians. And it doesn't matter that there's only 2. These people are really hurting, and their families and all their loved ones. So please keep them in your prayers. The 2,973rd death in West Virginia is a 91-year-old male from Raleigh County. The 2,974th death is an 81-year-old male from Cabell County. Nevertheless, don't let them become a statistic, please. Our numbers continue to ramp up. We have 546 new positive cases in the last 24 hours. The daily positivity rate is still sky high. It's at 6.35. Our cumulative rate still continues to move up. It's 4.96. Get this number. We have 4,625 cases that are active in West Virginia. We have 275 people hospitalized and 114 people in the ICU units. This is the first time we've been over 100 people in the ICU units since February the 8th. We have 5 red counties: Marshall, Wetzel, Upshur, McDowell, and Wayne County. We have only 11 counties that are left in the green. You can see the map. It surely doesn't look the way we want it to look. I remind you over and over and over, if you're 65 and older, if you have any symptom whatsoever, to go get tested, and the antibodies very well could end up saving your life. I've got just a announcement. A great friend, someone we know and we love, is Gil McClanahan. And Gil is hospitalized at the St. Mary's Hospital in Huntington with a non-COVID illness, but he's having a tough time, a really, really tough time. And he's covered the news in West Virginia for over 30 years. He's a good man with a beautiful wife, Connie, of 20 years, a Putnam County resident, and a man that has given so much to West Virginia. So I ask all of you in prayer to reach out to Gil and his great wife and family. He's got a great son, Trevor, and please just reach out to them and in prayer, and we'll hopefully very soon see Gil back and all goodness happen and everything. But Gil, we want you to know that we're with you, and we're hoping and praying in every way. And I'll say great big prayers and everything, for your speedy recovery. I've also got to announce that we've lost 2 miners, one today and one earlier this week. These people, and I know this industry so well. My family's been in this industry forever. One was an independent coal truck driver that was fatally injured early this morning in Randolph County. His name is Timothy Keith Collins of Mill Creek, 53 years old. It's terrible. Another miner that died following an earlier incident was 60-year-old Jeffrey Allen Hudnall. And he was working at Marfork Coal Company in Raleigh County, and on August 4th, he suffered his injuries there. I just want to say just this. The mining industry, like the farming industry and surely other industries that we have, they're dangerous. That's just all there is to it. And we've got to continue to stress safety in every way. But we've got to salute these great, great men and women that absolutely power this nation and produce the greatest coal on the planet for making steel and power the nation in so many ways, and have done so forever. Absolutely. Every day we want them to get home to their families. But what they've given us is really important. So, you know, I hate it like crazy anytime and every time that we lose a coal miner. I tell you again about your face coverings and everything. This Delta variant still continues to raise an ugly, ugly head. There there's some areas in which, and I think, you know, I probably ought to go into this right now, but West Virginia Wesleyan just announced that they're going to charge people, their students, a non-refundable fee of $750 for students who will not, either have not been vaccinated or will not submit proof of vaccination, you know, of their first shot by September the 7th. Marshall is requiring face coverings there for all their students and everything. They are not requiring or mandating anything at this point in time in regard to the vaccinations. Monongalia County, all students K through 12, staff and faculty will be wearing masks in Monongalia County starting the 19th of August. Kanawha County, the students in pre-kindergarten through the 5th grade will be wearing masks. Students 6th through the 12th grade, you know, it's optional. Putnam County is saying no mask, and the state of Maryland has adopted a similar policy and everything. From the standpoint of where I stand on that, I'm trying to give a lot of leeway to our local officials. But if this thing continues the way it's going, you'll just have to look for the fact that we will have to adjust, and we probably will end up having to move in this direction. You know, it is absolutely without question, and I might as well just show you this right now. This map is the county transmission map of the United States, with the lowest being in blue, the next being moderate being in kind of a tan or a yellow, substantial being in maybe an orange, and the red being in high. July 5th, you have a map on the left. August the 9th, you got the map on the right. It's plain to see that this Delta variant is here, and I've urged and urged and urged everyone to move and get vaccinated. Now, over the weekend, and I'll get to that in just, well, I might as well do it right now. Over the last few days, we vaccinated 1,700 folks since Monday. Well, that's good in a lot of ways, but it's not enough. It's nowhere close to enough. We do not have people running to the fire like they should right now. Absolutely, without any question, we've got 89.8% of our 65 and olders with one shot and 83.1% of our 50 and olders with one shot. We're at 69.2% of all the population that's eligible 12 and older. All that's good, but it's not good enough, especially with our kids. With our kids going back to school, I urge you beyond belief to absolutely get these kids vaccinated. And we just got to have more people running to the fire. This Delta variant now is in 35 counties. It's still the most prevalent in Berkeley County. You know, the vaccines are tremendously effective against this variant, and it is absolutely another strain that is absolutely highly contagious, and we urge you to get your vaccines. The vaccine eligibility, 12 and older, you were reminded to get your second shot. We need the older folks and everything to help us get the young people vaccinated. It is foolish for us to not have our kids vaccinated. You know, all the COVID information's up there on our vaccine info line. And to do it for baby dog efforts on the last go-round, we had some exciting stuff that happened yesterday. And, you know, we had 385,097 people that were registered. You know, we had 4 different stops. We had truck winners Paul Swartz, and we had a registered dietitian. I'm sorry, he is a registered dietitian at the Jackie Withrow Hospital. We had Megan Landsberg. She is a professor of music at Marietta College and lives across the border in Vienna, West Virginia. we had one, you know, the winner of our $588,000 winner, you know, was Kara Waldeck, and she's from Charlestown in Jefferson County, but she just happened to be visiting in South, and so we caught up with her at the Southridge Golf Range, and I'm gonna mispronounce this, but is it Larabee's Pizza? You know, and maybe I got that. The Southridge Golf Range and Larabee's Pizza in Charleston. We caught up with her there. It was her grandfather's birthday, and you know, great goodness alive, baby dog, you're gonna have to cut back a little bit, you know. But she's a person that actually administers doses of COVID, you know, at her job at Walgreens and the Walgreens pharmacy, and so we thank Kara in every way. She was excited, and she's on to her life in a bigger and better way. And then we went to Spencer, and I guess we went to Marietta, Vienna, and gave the truck to Megan, and then we went to Spencer. There was a gentleman there. His name is Wallace Board, but it goes by Wally. And really and truly, this man and his family are so good and just a prince of a man. And literally, he was dumbfounded, and it was just wonderful to be in Roane County. We had the opportunity to go by the hospital, and I'll tell you about that in just a second. But his family has lived in Spencer, West Virginia for 6 generations. It's great stuff. So, Wally, again, congratulations in every way. We had 2 scholarship winners. Well, let me tell you about the hospital in just a second. They just completed a $30 million renovation there and upgrade, you know, on an upgrade project and everything, with a community fitness center and a restaurant in it and everything. Absolutely, that hospital looked fantastic. You know, Doug Bentz is their administrator and everything, and he was with us, and that's Doug right there, and so it was just a great day. You know, there was lots and lots and lots of stuff. Bob Ashley went over all kinds of different stuff that was going on, had been going on in the Roane County area that we've been doing with the Roads to Prosperity programs and all kinds of different stuff. But it's just a good day in Roane County there. So I was tickled to death to do that. That was good. You know, I've said it over and over to you. At least in my opinion, I think the governor of this state needs to be out and be with the people, and that's what I do. And you know, I'm not just going to sit, you know, somewhere and push paper around and everything and accomplish nothing. I'm going to accomplish, and so we're out, and that's what we're doing. But nevertheless, you know, I want to go back to our do it for baby doll stuff. We had 2 scholarship winners, because I always loved this the most of all of it. You know, one was. Is this Shelian? Okay, Shelian Cummings from Gary in McDowell County won a full scholarship to any public institution in West Virginia. And Ashley Goots, is that right? Or Goats? Is it Goots? I think it's Goots. Ashley Goots from Bridgeport in Harrison County also won a full 4-year scholarship and everything, to, you know, room, board, everything. And Ashley's joining us virtually today, and I can't wait to see her, so bring her up. Hey, Ashley, gosh, you are so beautiful. Congratulations.
Thank you. I really appreciate it. It's a great opportunity that I have.
Well, that's really great. Tell me what you like the best about school. What activities do you do besides, I know you're a great student, you have to be, but what other things do you do?
So I'm a finance major at WVU. I'll be a junior starting this year, and I enjoy working out. I enjoy taking the workout classes at the rec center early in the morning before school starts, and I have a job up here, and that's basically what I do on my free time other than school.
Well, Ashley, listen, thanks so much for getting vaccinated first and foremost and registering. But more than anything, I love that you're a finance major. I mean, that's really neat stuff and everything, because because I went to the school business and everything. I was a management major, but nevertheless, way to go. I'm really proud of you, and so keep up the great work, and congratulations again.
Thank you.
All right, be good. Okay, remind everybody about our free testing. Get tested, and thank Frith and thank Walgreens so much. We have 17 outbreaks now. It just keeps growing and growing. In our long-term care facilities, we have 13 outbreaks in our church communities in 12 counties. That just keeps going and going, people. You got to realize that absolutely, without any question, in our long-term care facilities, if we have outbreaks, you could very well be looking at the folks that absolutely we could lose. A lot of people in our church community and everything are elderly people, and you've got to watch. You've got to watch what you're doing there, because we're going to end up losing folks that still have lots and lots of lives left and everything. But 13 outbreaks in 12 counties. That's Cabell, Fayette, Jackson, Jefferson, Marion, Mason, McDowell, Nicholas, Putnam, Raleigh, Taylor, and Wayne counties. Goodness gracious. It's been a long time since we've seen stuff like this. So buckle up just a little bit, West Virginia. Just absolutely buckle up just a little bit, and we'll get through this. Corrections, we got 29 inmates and 14 staff cases. I encourage you over and over about giving blood. I've got some additional announcements here. And this is great stuff. Great stuff for our businesses, because our state's doing good, and absolutely in turn we keep lowering and lowering our workers' comp rate. It's just good stuff. But the National Council on Compensation Insurance, West Virginia's rating and statistical agent, has filed a proposed workers' compensation loss cost decrease of 7.9%. It's going to be effective on November 1st, 2021, so just a few months from now, and it's due to the fact that we've again projected $15 million in savings to the West Virginia employers. That's great news. We have two congratulations to U.S. the prosecutors that have just happened and everything, but President Biden nominated current West Virginia Senator Bill Eisenfeld, I hope I pronounced Bill's name correctly, and everything, to serve as the United States Attorney for the Northern District in West Virginia. Congratulations, Bill. And President Biden also nominated Boone County Circuit Court Judge William Thompson to serve as the U.S. Attorney for the Southern District of West Virginia. And congratulations, William, and I congratulate, like I said, both these men. Both these men will do a wonderful job. And I urge the U.S. Senate to absolutely confirm them both. From the standpoint of the infrastructure bill, the U.S. Senate just passed a $1.2 trillion bipartisan effort on an infrastructure bill. The vote was 69-30. Thank God we've absolutely got a vote. It's just not straight down party lines. I congratulate Senator Manchin and Senator Capito, but, I know that Shelley's worked super hard on this and everything, and I know Senator Manchin has also, but I thank them for their yes votes, and if the Senate version passes, West Virginia could expect to receive, get this, $3 billion for federal aid for highway programs and $506 million for bridge replacement and repairs over the next 5 years. It absolutely, I am gunning for in every way for us to some way, somehow complete the Coalfield Expressway and the King Coal Highway, and absolutely Quarter H is the #1 project in my eyes in this state. But there's lots and lots of others. There's no question there's lots of others, but we've got to have Quarter H done, and we've got to bring Southern West Virginia back into the real world in contact with everybody. I congratulate the folks at Marshall. Yesterday, Marshall University, Bill No, flight school officially opened yesterday at the Yeager Airport. You know, they're going to be training pilots and everything. I thank President Gary Gilbert and Bill Noe. Bill Noe is the CEO of NetJets. Nick Keller, the director of the Yeager Airport. And I congratulate all the folks on the Kanawha County Commission. Now, you know, President Kent Carper and all the folks there. They just do. They just, you know, Ben Salango, they all, and I don't know, I know I'm going to miss some names, but nevertheless, you know, I thank them for all that they do every day. You know, I've really believed in investing in airports. Without any question, I think that is the heart of the engine that drives our communities. Yeager Airport is a shining example of absolutely how investment absolutely turns the key to make all kinds of goodness happen. So we're going to keep pouring it on and keep doing more and more good things for our airports, and I know in turn they do so much good for all of us. And so again to all those, and I know I'm missing somebody, but I just can't place it and everything, but you know, to Kent and Ben, thank you, and you know, for all you're doing on the county commission, and please forgive me for not knowing the other commissioner, but I'm sorry, Wheeler. Okay, Commissioner Wheeler, you know, everything. Okay, I'm sorry, sir. I just went brain dead here. Okay, Jordan, can I make this announcement? Okay, here's a really good thing. You know, all of us have really worked really hard on the Milan situation, and that company now is called Beatrice, and everybody's worked. Everybody's worked. Today, WVU and Beatrice made a big announcement, just made it. WVU and Beatrice are going to negotiate a memorandum of understanding to hopefully transfer the Milan plant to WVU. Then WVU will work collaboratively with the Department of Economic Development, and find potential companies to use this space. WVU's goal is to grow jobs in north central West Virginia, and this is a great announcement, a great announcement. I want to thank Beatrice for coming to the table and working with WVU on this, and we are still pushing in every way in the world to find ways to employ these great employees in the pharmaceutical areas on what they have done for us forever. These people were so good at their job. It was off the chart how good they were at their jobs, and really and truly to let them die on the vine is just the wrong thing to do. And so we're continuing to push it. We congratulate WVU and Beatrice for getting together, but we've still got a long ways to go to turn that into real employment for these great employees that were doing such good work, and we want them to have high-paying, great jobs, and we're going to keep trying every way we possibly can to pull that off. That's all I got. There's a lot of stuff today. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. And following up what the governor has said, I think it's really important for all West Virginians to be aware of accurate information. And there's been so much information that's been moving through our press briefs and things that have been published and things that are online that I wanted to spend just a second trying to clarify what I think is a really important issue. There is a lot of information that's being pushed out about the role of vaccines with the Delta variant. And there is a couple of really critical things to understand. And I want to make sure I'm saying this very, very clearly. So we know that by a large margin, the real intervention that we have at our disposal that saves lives and improves the health and well-being of our citizens and protects our hospitals and healthcare capacity to be able to take care of our citizens are vaccines. And I think that it's really important that I say it that clearly, because people are confused about the Delta variant and vaccines. And I'm going to try to clear up one point that I think people are stuck on. So vaccines are made in order to protect people from very severe consequences of human infectious diseases and other diseases that vaccines are used for. They're used to help the body become more resistant or able to deal with these infections in a much, much more powerful way and a more effective way. The Delta variant of COVID-19, which is the dominant variant in our country, and the governor showed the map, everything's going red, and the dominant variant in our state. And when I say variant, what I mean is it's the new strain of COVID-19. And this strain or variant of COVID-19 is much, much, much more able to infect people than any other variant or strain that we've seen so far. It can infect people like perhaps chickenpox can. It can infect people who are around others for a very short time if other people are infected with this variant. And it can make people who are not vaccinated very, very sick, including children and infants. And we've seen that around the country. Now, importantly, though, this variant is a virus, just like COVID-19 has been. This strain of COVID-19 is a virus, and it's very easily transmissible. But people that are fully vaccinated don't go to the hospital, they don't go to the ICU, and they don't die of that exposure. People that are not vaccinated have a 25 times risk of getting into the hospital, going to the ICU, or dying than people who are not vaccinated. We'll say it one more time. If you're fully vaccinated, 14 days after your last dose, you have a 25 times protection against going to the hospital, going to the ICU, or dying of COVID-19. And we know that in our country today, the people that are in the hospital, people that are in the ICU, people that are dying of COVID-19 are almost all not vaccinated. And that's the reason why the governor is pleading every day and encouraging, as well as General Hoyer, Secretary Crouch, Dr. Amjad, me, everybody else, because it is so critically important that we have our population who is eligible to get vaccinated. Now, the confusing thing for people is that there's a difference between perhaps being fully vaccinated and getting reinfected with COVID-19, which we've reported, say, in the Massachusetts, in that beach town in Massachusetts, Provincetown, where 3/4 of people who got infected in the big outbreak around July 4th were fully vaccinated. So the difference is those people got infected again, even though they were fully vaccinated, but they didn't get sick. They didn't go to the hospital. They didn't go to the ICU. They didn't die. And the difference here is really important, because being able to get infected again and have mild symptoms is not what we want. And those people might still, the people even fully vaccinated who get reinfected might be able to spread COVID-19, which we don't want either, but they are protected against the most severe consequences. And if we look at the role of masks, we want people to consider, wearing masks that fit tightly around the face, even if you're fully vaccinated, if you're going indoors into big groups, into big crowds, people you don't know, because there is a risk that you could get reinfected and that you can infect other people. But if you're fully vaccinated, you should feel safe that you're protected against hospitalization, ICU admission, or death. So I think that the confusing thing is saying that people that are fully vaccinated could still be reinfected, but not get much in the way of symptoms themselves, but they could potentially spread it to other people. And that's where the mask suggestion guidance from the Centers for Disease Control came out, because they want to protect everybody in the environment. And masks are better at protecting you from infecting other people, per the CDC, with this variant, than masks alone are effective in protecting you from getting the virus from somebody else. So masks are an important augmentation, but they really serve as another layer of protection for vaccines. So I hope that was clear. The bottom line is fully vaccinated people, West Virginia, Americans, world citizens, are protected against the severe complications of the Delta variant of COVID-19. And that is why we want every West Virginia who's vaccine eligible to please get fully vaccinated. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just want to report that yesterday our Interagency Task Force worked with Chancellor Tucker, Dr. Persley, and the folks at Higher Education Policy Commission and other agencies and organizations across the state to run an exercise to better be prepared to support our higher education institutions as we go forward with the school year. We're also working very closely with Superintendent Birch and his deputy, Michelle Blatt, and others in that department to make sure we're prepared to assist schools. I'd like to spend the bulk of my time clearing up what was some inaccurate information that appears to have been put out. There was a story out on a couple of news media outlets, the headline of which thousands of vaccines wasted in West Virginia. So let me clarify this for West Virginia. I believe it was based off a CDC report that came out last couple of days about 500,000 doses not being used in the state of West Virginia. Let me clarify that is 500,000 doses that would have been allocated to the state of West Virginia. There were not 500,000 doses sitting on a shelf in the state of West Virginia that went unused. Of that total number, there are 103,000 that may expire in the next 28 days if the federal government does not allocate those across the 50 states in the system. So what they've done is they've taken the total number of people currently eligible, the total number we vaccinated, and those were allocated doses. Over our time at the state level with the doses that we have control of and manage, we have had 4,000 doses of spoilage, primarily related to the fact that as we deliver doses out into our rural areas, there are cases where we'll only use a certain number of doses out of a vial. We have done an exceptional job as the state of West Virginia at managing the doses that are allocated directly to us. Currently, the state of West Virginia has 30,000 doses in its direct control, and we have projections that all those doses will be used and we'll be ordering more doses. I guess the unfortunate part of this is it's not accurate in the way it was portrayed, but it's also unfortunate that there are doses in the federal system that we can get access to if more West Virginians will do what Dr. Marsh, the governor, Secretary Crouch, Dr. Amjad, and I come on here every day and encourage you to get vaccinated, West Virginia. We need to get vaccinated. But I just want to make sure that West Virginians know, under the governor's direction, we are effectively managing the doses that we have direct control of. Thank you.
Thank you, sir. Next to Secretary Bill Crouch with the DHHR.
To the COVID dashboard. The governor continues to require transparency with everything we do and to push out all of the information we can push out. Today, we implemented changes to the overview tab for the total number of cases and death boxes. We've added the vaccine breakthrough numbers and percentages on the pop-up windows. I think Jordan is putting that up. So if you tap on the total number of cases, you will see at the bottom the total number, or the third line down, the total number of breakthrough cases, which is 2,302. That is 0.26% of the fully vaccinated people who develop COVID. Again, as the governor talks about and Clay talk about every time we're on, that's a very, very small number. This vaccine protects you very efficiently. If you tap on the death box, you will see confirmed deaths, probable deaths, and then the total number of breakthrough deaths that we have. That is 53. Only 53 deaths have occurred as with individuals who have COVID. Of the total number of individuals who have been vaccinated, that is 0.006% of those individuals who have been vaccinated. Again, an amazing number for us. The other changes we made are on the 7-day trend. The 7-day trend now has age breakdowns which correspond to the vaccine approvals that we've received. So we have changed this so that we are looking at age 5 to 11, which is what we think will be the next group that's approved for the vaccine. We have 12 to 15, 16 to 20, and up. So we've tried to provide a greater breakdown so that we can look at what ages have been vaccinated and what ages have not. And then finally, on the vaccine summary tab, we have those same age groups broken down in percentages vaccinated for each of those groups. So again, we appreciate the suggestions that we receive. We try to look at those. Sometimes they're doable, sometimes they're not. I want to thank our dashboard team, especially Tim DeBar, who is so dedicated to this. But again, keep pushing us suggestions. We'll push out everything we can. Thank you.
Thank you, Secretary. Dr. Inamjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you for taking my question. Governor Justice, thanks for mentioning Gil McClanahan, my coworker here at Eyewitness News. He's having a tough time. He is hospitalized, and we are all thinking about Gil today and thoughts and prayers to him and his family. But we appreciate you mentioning him. Thank you very much. I have a question for Dr. Marsh. Dr. Marsh, this has come up with some people who are, I guess one way to say it is they're not very comfortable with the situation of mandates from the government and wondering about when things will end, et cetera. For fully vaccinated people, how long do you think this will continue where there are mandated mask usages, or at least the governor today was intimating that possibly that could happen again if we swing back, the pendulum swings too far the wrong way? Is this something that has a foreseeable end, or is this just something that is going to go on in perpetuity with no end in sight? Because that's hard for some people to swallow. We have many, many dangerous situations that we deal with every day. Sickness, flu season every year. Is it something that perhaps we should wear masks now every flu season? How much do we weigh mitigation and prevention versus individual choices? I guess that's what the question boils down to. Thank you.
Dr. Marsh, go, sir.
Thank you, Governor, and thank you, Kenny, for the question. You know, I think that the question is really has two different parts to me. You know, the first part is, of course, we're in the middle of the most unique public health crisis that our country has seen in the last century. And ultimately, you know, Kenny, we are seeing this pandemic unfold. And as we have talked about from a public health standpoint, we have miraculous interventions that are available to us called vaccines. And that if people become fully vaccinated, all of our eligible populace, then that will effectively, I think, help us get fit enough that we're able to, you know, defeat the COVID virus and reduce new variants or new strains from arising that may have even more problematic properties for us as the Delta variant arose in India. I would say the second part of the question is that when we look at mitigation strategies, like for instance, masks or physical distancing or doing those other practices, I see that in many ways as a commitment and a decision in altruism. I mean, one of the things, and I wrote about this before, and I know that maybe not everybody is agreeable to almost anything these days, but one of the things that I wrote about was that I thought a key element to our success to date is our kindness. Our kindness as a state, our kindness to each other, that goodness that the governor talks about. And this is part of that goodness. So to me, as a fully vaccinated citizen, I am wearing a mask going indoors and going around crowds and et cetera. And I'm doing it really for two reasons. One is that I do understand that I need to practice what I'm preaching, and it's important for me to not, be a person who spreads COVID-19 if I would happen to get reinfected with it. But as a fully vaccinated person, I feel very safe that I'm protected against the most severe consequences. But I'm also doing it because I care about, my role in the state as a citizen and my responsibility not only to myself, but to my other fellow residents and community members. And so I see wearing a mask not as a punitive measure. And of course, the governor has not made a mandate, and we don't have a national mandate. So people choose their own path there. But I see it as an act of citizenship, civility, working as part of a greater whole, and showing that I am trying to practice the golden rule, because I hope that other people show that same level of altruism and kindness to my family and the people I love, as I hope that I can to others.
All right, thank you, Kenny. Next to Mark Curtis with Nexstar Media.
Thank you, and let me join the chorus of voices sending prayers to Gil McClanahan, a really good guy and a great news reporter. We wish him a speedy recovery and are praying for him. This question is probably directed at General Hoyer. The governor can chime in too, but Dr. Sherry Young, who heads the Kanawha Charleston Health Department, restarted her Saturday clinics for vaccinations and testing last weekend. They're going to happen this Saturday and next Saturday. They're also scheduling one for Nitro. So they're really ramping it back up in the state's most populous counties. Are we seeing this in other counties and other hot spots around the state? Kind of give us a sense of what all the county health departments are doing to kind of kickstart their testing and vaccination and taking it to the next level.
General Hoyer and Dr. Amjad, y'all take this, please.
Yes, sir. And I'll start out. Mark, I think you're correct, and you're seeing that in Kanawha County, and Dr. Sherry Young have been a great partner. I know that up here in Monongalia County, Dr. Lee Smith and the team here are starting to do the same thing, and Ein has a lot of regular contact with our county folks and may have some other examples for us. Ein, I'll turn it to you.
Thanks, Jim. Mark, we're working with the health departments now. There's some health departments will start doing that. We're also still working with our joint interagency task force to set those up. We do know some health departments are working on restaffing. They've been working really hard this past year. So we are going to start doing that because we know testing is important. Our health command team also still has their testing sites. So we do have a lot of free testing events around the county, around the state, as well as farmers have testing too. But you're right, Dr. Sherry Young, Dr. Lee Smith, they have those events as well. But we are going to start doing that, ramping up testing across the state. Thanks.
Thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if someone could give us an update on our battlefield booster assessment. I know that's underway. Are there any results that we've gotten from that we could share? I know we were looking to measure antibodies. I was wondering if the initial tests have given us any results. Thank you.
Charles, let me start with this, and I want to defer to Dr. Marsh, maybe General Hoyer as well, but we met on Monday in Morgantown, Dr. Marsh and General Hoyer and myself and everything, and one of the big subjects was just this, the booster vaccinations and, the booster battlefield assessment. We all pretty much decided we wanted to move, and we want to move right now. And from that, then we were teeing up to not only just be in the assessment business, but we were teeing up to drop the hammer and move to start vaccinating people and giving people their booster shots. I got a text later, from Dr. Marsh that said, in looking at all this has become more cumbersome than just, moving forward right now. And in doing so, there may be a way to reach out and begin to move forward and let West Virginia be a trial state in moving forward with this. I really believe that we've got a very vulnerable population in being as old as we are, and with all the illnesses that West Virginians have and everything, we are putting a lot of people at risk that are 60 years old and older and are 6 months out from the first vaccine, and we know that. Now, Dr. Marsh can take it from there, but we're working on it, Charles, and we're working on it to move absolutely as quickly as we can to be moving forward to where we are really giving booster shots and not only assessing, but we're on to something here in West Virginia in doing so, and I'm very proud of it. But anyway, Dr. Marsh, go, please.
Well, thank you, Governor, and thank you, Charles. Charles, as the governor said, the real impetus behind the booster battlefield assessment was to try to rapidly gain insight into our most vulnerable populations, which, as the governor said, would include people that are greater than 6 months out from their first vaccine, people that are older in that category, particularly people that are immunocompromised, and also people who may have received a single dose of Johnson & Johnson with the question of whether or not there'd be benefit to consider a third shot, a booster shot. Of course, as the governor indicated, we want to be sure that we are in sync with the Food and Drug Administration, the Centers for Disease Control, and the Advisory Committee on Immunization Practices. But because of our aggressive stance at the beginning of the pandemic, the fact that we were first in the country to immunize our nursing home population, our assisted living population, and many of our elder population, and the fact that we have a high level of chronic comorbid medical illnesses, we do feel like that our population may perhaps be the most vulnerable in the country, and may be the population that would benefit the most from consideration of booster vaccines. So we are working with the governor and outlining a potential strategy to him where we would potentially position ourselves as a pilot site to be able to gather that real world data, not only in the booster battlefield assessment, but to position ourselves potentially as a first in the United States opportunity to perhaps work with these federal agencies to look at the impact of doing those booster vaccines. And this is something that we will detail as we get more clarity from our partners on this. But we do believe wholeheartedly that as our oldest population, most vulnerable population, is the longest vaccinated population in our country, that we have the highest potential benefit for our population as any to be able to look at that third booster, and particularly look at that as we see that there are sufficient numbers of vaccines in our country to be able to not only give people who haven't been vaccinated their vaccines, but also be able to consider those folks in the category the governor outlined to potentially be eligible for a third vaccine, of course, done in collaboration and under the guidance of the FDA, CDC, and our White House colleagues.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Listening to Dr. Marsh here, it kind of sounds like you know what you're going to find already, and that you're going to be ramping up a booster shot program. General Hoyer, the question is for you. How quickly could that happen? Is that something that you could start tomorrow, or would you need a week to get it going? Are there operational challenges that I don't know about? Thank you.
General, before you go, Paul, let me just make a comment. you have thrown a watermelon to General Hoyer, and he's standing with a tennis racket ready to answer this question, because this is right in his wheelhouse. General, go.
If I mess this one up, Paul, the governor's going he's going to be on me the rest of the month or better, probably. So, Paul, we have already been preparing for that, so that the minute that the opportunity exists, after the booster assessment and the work with CDC and others, we will be doing vaccines that day. So we're already working with our partners at the Healthcare Association, with the nursing home facilities, with our other partners in pharmacies and federally qualified health clinics, so that as soon as the authorization is there, and as the governor pointed out, he and Clay and I talked about it on Monday, and we, along with the governor, want to be exceptionally aggressive to take care of our most vulnerable population. So it will happen immediately once we're ready to go.
Let me just add this, Paul. You know, it's such a salute to just how good these people are, just how good the general is, the interagency task force, all the guard, all the pharmacies across this state. I'm telling you, we're on this, and so that's why I teased a little bit about him answering that question. They just do a phenomenal job.
Thank you, Paul. Next to Katie Ree with WDVM.
Hey everyone, thanks so much for your time. So this could be for a number of people, but with the Do It for Baby Dog vaccine incentive program having concluded, what are the next steps to try and motivate people to get the vaccine now that it's over? I mean, the Delta variant as well as the Lambda variant are concerns for the country and the world, but also specifically the state. So if you guys could touch upon that, I'd really appreciate it.
Well, let me take this one, guys. I think Mark Curtis really gave us some ideas that really are worthy, but from the standpoint of how to appeal to our younger folks, maybe we do another baby dog campaign. If we can find the funds to be able to do it, we do another baby dog campaign, and we do it in a way that is really more directed at trying to get our younger people vaccinated. From the standpoint, Katie, of all the people around, that are still our elderly population, we've gotten a tremendous amount or percentage of them vaccinated. But at the same time, with how infectious this is, their motivation's got to be one thing. I don't want to be in the dying lottery. I want to be in the living lottery. And so, because they still got a lot of life left in them, and a lot of good days, and a lot of fun experiences and everything. And so we'll continue to work on it. We'll give baby dog just a little bit of rest. I mean, last night, when she's out there driving, is hard on her, because she's, she's a 60-pound brown watermelon in a seat, and we can't get her comfortable, and so therefore she stays up all the time and everything. And bulldogs sleep a lot, but she really, last night, she's either in the bed or under the bed every night, and then there's times, when I'll awaken and her face will be like right there, be like a half an inch from my face. I'll say, "Hey, baby dog, how you doing?" It's probably 3 o'clock in the morning and everything, but she is a wonderful, wonderful dog, and just she makes you laugh and everything. But last night, she was really sawing logs. I mean, I'd wake up in the middle of the night and I could hear her under the bed, so she was going at it. But nevertheless, so we'll work up something else and continue to try to motivate people. And Katie, thanks for the question. And anything the broadcasters, anybody can do to help, we got to keep at this, because this is our way out. I mean, the vaccines are our way out, period.
All right, thank you, Katie. We'll go back to Dr. Marsh for just a second for a quick clarification.
Thank you, Jordan, and thank you, Governor. I just wanted to make sure that with the comments that we made to Paul's question, I think, that we not confuse people, because we don't want people to show up in pharmacies to get a third vaccine at this point. We need to unfold our plan, and we hope that we can be the pilot site for the country to get the real world data. But please, until you hear further direction, we don't want people to mishear what we said and show up looking for third vaccines, because we are not approved to do that at this point.
All right, thank you, Dr. Marsh. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. My question is for Secretary Crouch regarding the new tab on the dashboard about breakthrough cases. Could you tell me the number of breakthrough deaths we've had in the state so far? And also, could you clarify when was the last time that number was updated on the number of these cases? I know that when I messaged the DHHR last Friday, they were quick in returning my request about the number of cases of breakthrough cases in the state. They messaged me that day and they gave me the number, but the number they said was only, basically it was as of July 1st. So could you give me a sense of the number that we have on the dashboard now? What date is that most accurate of? And give me a sense of basically what's kind of the delay on this data? How often can we expect to see that data updated?
Secretary Crouch, go.
Certainly. Thank you, Governor, and thank you, June. We're working on increasing the time frame between those polls. We've automated some of this, June, just as of this last weekend. So we're looking at making that automated on the dashboard so that it is up to date. Previously, we were only updating breakthroughs as well as variants on an interim basis, such as once a week. We're going to start doing that. We had a discussion yesterday. We're going to start doing that at least Monday, Wednesday, and Friday, same days that we have press briefings. But most of this now is automated so that it will come online as it happens. So the 53, to my knowledge, is current. It's up to date. There's still going to be a little lag, as we talked about before, in terms of death reports, getting those finalized, getting physicians to sign those, and getting that information to the state. It is sometimes a little slow. We're working on that, as we've talked about, in terms of a contract with a company to automate that. But there's always a little delay in death certificates in many instances. So, so we are automating this now to try to get that to you on a very regular basis.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, I think the only real notes that I've made that are of consequence here that haven't been gone over is to echo Dr. Marsh. There are no booster shots approved that we can give you today. But we're working on it. We're all over. We're pushing like crazy and everything, and we're trying to do assessment on antibodies and everything. And at the same time, we're trying to get the federal government to allow us to move forward in giving those booster shots. But as soon as we get the go ahead and everything, General Hoyer has already said, and I knew that he would be ready to answer exactly that, but he's ready to go right this minute, everybody. And as soon as we get to go ahead, he's just said it so clearly, we'll give the booster shots out that day. And we'll begin it that day and we'll continue on. It will not be a delay. As soon as we get to go ahead, we'll move. Anyway, that's all I got. Everybody be safe. Get vaccinated. Please get vaccinated. All right, thank you so much.